Well, welcome back, and I trust that you've been enjoying the show so far. Well, this segment, we're going to be discussing health issues, and we're talking about the STIs, herpes. We're going to be talking about HPV, human papilloma virus, and we're going to be talking about hepatitis B and hepatitis C. I've been joined by Dr. Kelvin Owusu, who is the medical director of OptimaCare Diagnostics. Good morning, doctor.
Good morning.
How are you doing?
I'm very well, and it's good to be here again.
Yeah, it's good to have you back. Let's get into STIs. It's a very interesting area for us to have a conversation about, because human beings, including Ghanaians, as much as we may like not to discuss the issues, we are very sexual people. Very. Somehow in Ghana, we act as though we don't know what you're talking about when it comes to the issue of sex, right? We act as though we don't even understand what sex is about. But somehow children are being born every day, So then somebody's doing something,
yes,
and in the midst of all this doing, unfortunately, there's also collateral damage that is happening on the side. People are getting sick and transmitting illnesses from one place to another. Let's open up with the basic introduction of what are STIs, and then we can narrow in and talk about the details.
Okay. So basically, STI simply means a sexually transmitted infection. In the past, we used to call them STDs, so that's sexually transmitted disease. But the name has been changed because not every infection will result in a disease.
Okay.
It doesn't mean, however, that the person who is infected is safe. And so we had to broaden the definition so that we can capture those who may not have developed a disease but have the infection. Because the thing is, once you are infected, you can infect the next person.
Okay.
Whether you are showing disease or not is not important when it comes to the infecting others. And so sexually transmitted infection is a broader group of. It takes into consideration a broader group of people who have been exposed to a germ and are themselves infected and can become transmission points to other people. And so that's basically it. These are germs that can only be transmitted through sex. These germs are actually very, very weak. And so that's why they need very intimate contact for them to be able to move from one person to another person.
Okay.
If these germs were left in the open air, they would die.
They won't survive.
They won't survive.
Okay.
But once you have that intimate connection with another person through the sexual act or through the exchange of body fluids, then they can easily move from one person to the other person and begin their life cycle in that new person.
Okay. Now, so when you say body fluids, clarify for us, is it all body fluids or is it specifically sexual body fluids? As in, when I say all body fluids, I'm talking about, so does the transmission from kissing and all of that also, is that a possible way of transmitting?
So even though most of them are transmitted through sexual body fluids, some of them can be transmitted through other fluids as well.
Okay.
So blood, saliva. Saliva is actually a common conduit for a number of the sexually transmitted disease infections, especially herpes, which we are going to talk about, and even the hepatitis as well. They can be transmitted through saliva. And so we have to understand all these things so that we know that even though they are called sexually transmitted infections, they can also be transmitted through other body fluids as well. And may not even be sexually related at all. Once there's intimate contact between a body fluid and another body fluid, or this person's body fluid and that person's body fluid, there can be transmission.
Okay. All right. Now let's dive into the three key ones we want to talk about for today. Let's start with the hepatitis. Now, I know hepatitis is a large family of different illnesses there. Yeah. And hepatitis is related to the liver.
Yes.
So explain to us what hepatitis is, and then let's narrow down to the B and C in particular.
So, as you rightly said, hepatitis is a group of viruses. I mean, we have hepatitis A, hepatitis B, C, D, E. I mean, they keep discovering new hepatitis viruses. Now, they are called hepatitis viruses because they sort of multiply in the liver, but they have effects outside the liver as well.
Okay.
So the fact that they are called hepatitis does not mean that they only attack the liver. They have extra hepatic manifestations as well.
Okay.
So that's it. The hepatitis A it's not a sexually transmitted infection. That one is transmitted, we call it fecal-oral.
Okay.
So somebody has the infection, uses the washroom, doesn't wash the hand, shakes your hand, you can't actually catch the hepatitis A. So that one is fecal-oral, so that's not part of our discussion. But the B and C are sexually transmitted, and that's and in fact, hepatitis B is actually more infectious than HIV.
I see.
Yes. If you are exposed to hepatitis B and HIV at the same time, you are more likely to catch the hepatitis B than
HIV.
It's
Wow.
actually more infectious.
Wow.
Highly infectious, more than the HIV.
Why are we more afraid of HIV though?
Well, because HIV will kind of kill you faster than hepatitis B would.
So hepatitis B will spread faster.
Yes.
But HIV is more likely to kill you.
Yes.
Okay.
Yes.
All right.
And so and also we have, or at least we developed we developed treatment modalities to to hepatitis B much earlier than HIV. So people became a bit more comfortable with hepatitis B, even though, like I said, it's more infectious and can still kill you. In fact, it will eventually lead to complications that will kill you.
I see. So what's hepatitis C?
It's also sexually transmitted. So there's hepatitis B and hepatitis C. And the interesting thing is that if you are exposed to one, in general, if you are exposed to one STI, the likelihood of catching a second one or a third one is much higher than the general population. So somebody who has hepatitis B, when it comes to us as doctors, we will automatically check for hepatitis C and HIV and all the other things, because I mean, bad habits sort of
die hard.
Exactly. So, so if you have been exposed to one, you are more likely to catch another.
I see.
But it's a virus. It's a sexually transmitted virus predominantly. It can also be spread through blood transfusion, and this time saliva plays a key role. So if you shared eating utensils with somebody who has hepatitis B, you could actually catch it, because, like I said, it's highly infectious. So it's very important that we know our status. And the good thing about hepatitis B, which also makes people more comfortable, is that you can protect yourself with vaccine. Yes, and so that's one reason why people are more afraid of HIV than hepatitis B, because if a husband has hepatitis B, their wife can take a vaccination and they are okay. But when you have HIV, there's no vaccine as yet, and so it's scary.
And can hepatitis B be transmitted into the birth of the next generation?
Yes, it can be transmitted through birth. It's, in fact, that used to be one of the major forms of transmission, maternal to child, mother to child transmission. But again, thankfully, we have modalities to stop that. And so when you are pregnant, one of the first tests that the doctors will run is a hepatitis B check. To make sure that if you are positive, then there are modalities to be put in place to protect the unborn baby. And so those systems are there. That's why it's important for pregnant women to attend antenatal sessions, because if they are picked up early enough, you can protect the baby, and then they'll counsel you as to what happens after birth, because after birth, also a chunk of babies are infected after birth. Yes, if the mother is positive, the baby can get it even after they've been born. And so there's a lot of counseling, a lot of training they will take you through to prepare you for the baby, to prevent the baby from getting it. Because the earlier you get that virus, the more likely you are to develop the complications at an earlier. So if a baby gets hepatitis B, by teenage, early adulthood, he or she will be developing the complications. So we want to, as much as possible, prevent them from getting it.
Tell us about the human papilloma virus.
That's actually one of my pet viruses, if I can call it that. Now, the HPV, HPV is the commonest STI.
Really? Interesting.
Yes,
but
actually.
We don't hear much about it.
Yes, because, well, again, even though statistically, almost at least every person with multiple sexual partners has been exposed to HPV at one point in their life. Yes.
Interesting.
Yes, it's that common. Very, very common. However, or rather, thankfully, many of the strains of HPV are not, they don't cause too much harm. So you get exposed to it, and then the body is able to take care of it and clear it eventually. So most people get away with it. However, there are a few strains of HPV will lead to something we call warts, genital warts. So you see there are these small growths around the pubic area, growths of skin tag. I think that's the common term, skin tag. Now, let me clarify. Almost every human being has one form of skin tag or another, because you may have a skin growth somewhere on your skin.
Yes.
It doesn't necessarily mean that you have been exposed to HPV. I mean, everybody has something like that. But then when you have a concentration around your pubic area, then you know that there's a problem. You've been exposed to the HPV, and some of them can become big and unsightly. You know, so that's HPV. So a few of the strains of HPV can cause the genital warts. Fewer strains. So there are several strains. A few of them will cause the genital warts, and a few are still, I don't know, the English is not coming. I mean, a smaller number of the strains will also eventually cause cancer.
Oh, I see.
So today we know for a fact that cervical cancer is, if not the only cancer that is sexually transmitted, because it's caused by the HPV, human papilloma virus, three strains in particular. And so if you are exposed to these strains of HPV, you will develop cervical cancer 10, 15 years from the time you
There's no way of preventing it? There's no way of treating it?
There's no way of preventing it, but there's a way of detecting it early.
Okay.
So that if it's detected early, then treatment can be started early, and then there's almost 100% survival or cure rate.
Okay.
But if you don't detect it, then it's more or less a guarantee that you're going to develop the cancer. You know, and so cervical cancer is known to be a sexually transmitted infection caused by HPV. Okay. And the people who are most at risk, I'm sure we'll talk about this, but let me just chip this in. The people who are most at risk of this are female or girls who themselves have multiple sexual partners. That's one. Number two, and I'm using girls because teenage years. That's the most at risk group of people. So girls whose partners, they may have been faithful to one person, but that person has multiple sexual partners. So it's very important that we understand these 2 points I'm making. You yourself may have multiple sexual partners. That's one. Or you may be faithful to one partner, but that partner has multiple sexual partners. Both of you are the same. You are all at risk of catching the HPV. And then people who have sex early in their teen years, you are also at risk of catching this HPV. That can cause cancer. Because the teen years, there's a lot of change going on. The body itself is undergoing transition. And when the cells are going through transition, they are vulnerable. Okay. So when you are exposed to the virus, because of that transition phase that you are in, it's easier for the virus to get access to the cells in question. Okay. And so you are most at risk. So people who have sex early in their teen years, you know, 17 and below, you are at risk of developing cervical cancer from HPV. Okay. And so because of this, there's a vaccination for HPV. The strains that are responsible for cervical cancer, there's a vaccine available. And the target group for this vaccine are teenage girls predominantly. Guys are also being vaccinated now because they also have their own cancer that develops from HPV. So the point is this HPV affects both men and women. But women more importantly because the cervix is hidden. You see, you can't see the cervix with your eye. I mean, no, you can't walk around and be looking at women's cervix. It's not possible because it's deep in there. The cervix is the mouth of the, so the womb is like this, and the cervix is the mouth of the womb. Yeah. Okay. That is where the cancer develops. So you can't see it, and because of that, we need to actually go look for it. So there's something called Pap smear, which every woman is supposed to have a Pap smear done at least once every 3 to 5 years. And if you did it and it was negative, then you'd repeat it every 3 to 5 years until you're 60, and then you'd stop. Because by then, the understanding is that if you were to develop, if you were to get infected at that point, you will not be alive by the time you develop cancer. So there's no point, stressing yourself. But before then, we have to keep checking so that if we see any change, we can treat it. Because once you catch, when the Pap smear detects microscopic changes. So once you have detected a microscopic change, it's easy to treat. But when the change becomes visible, then it's probably too advanced. So we want to catch the thing before it gets there. But like I said, thankfully there is vaccination. But let me just say that the fact that there is vaccination, that the vaccination does not replace the need for Pap smear. This is very important because there are women out there who have been vaccinated, and because of that, they never go for Pap smear. No, the vaccination reduces the probability that you will be infected. It doesn't remove it.
Totally, All right.
So the fact that you are vaccinated does not mean you don't go for pap smear. You have to. I'm stressing on this because, like I said, this is my pet thing. So I mean,
Yeah.
I've been involved in all these things. So you have to take the pap smear very, very seriously, especially if you if you have the characteristics I mentioned earlier. You had sex early in your teens, you've had multiple sexual partners, or your partner has multiple sexual partners. It's very, very important that you take pap smear very seriously because it could save your life.
Okay. Now, quickly before we round up, herpes simplex virus.
Now, herpes is I'm smiling because herpes is one of the most interesting viral or sexually transmitted infections. There are two: herpes simplex type 1 and type 2.
Okay.
In the olden days, it was so easy to tell which one was type 1 and which one was type 2 because type 1, you see it on the mouth. So we call it fever blisters, cold sore. There are so many funny names for
So wait, hold on. If we see somebody with a cold sore, does it mean they have herpes?
Well, yes, actually.
Okay. And does it mean it's sexually transmitted?
So that's what I'm coming to. So in the olden days, it was so easy. One of the mouth was type 1. It's not sexually transmitted. You just it's happened that what's it called? Your mother had it, and when you were being born, you also got it. So most people are born with it.
Okay.
You know. Now the type 2 also similar. The blisters and all that around them. You develop the blisters, which will then break into sores. But this time it's happening in the pubic area.
Okay.
So again, that was sexually transmitted.
Okay.
Now, in today's world, the whole thing spoiled because people are engaging in a lot of unusual sexual
oral
exactly.
Sex.
So now there's the occurrence of oral sex.
Okay.
So now we are having type 1 on the mouth. I mean type 2 on the mouth, type 1 down there. So everything, the whole thing is mixed up. So
because you are taking your mouth down there to go and collect what would have been on your
exactly.
Okay. All right.
The interesting thing about the herpes is that it only pops up when you yourself, your immune system has gone down.
Okay.
So you realize that whenever you're about to develop a major illness, say malaria or whichever, then you notice that you develop blisters, and it's quite common. A lot of people have it. You know, it's so common. Or when you are stressed, when you are under pressure at work, suddenly you break out in blisters because once your immune system goes down, then the virus is able to show up.
Yeah.
Now, this is because generally speaking, our body, our immune system we cannot cure viral infections. So that's why it's better to prevent it than to try and treat or cure it. So once you have this herpes simplex, it's going to be with you for life. But it's going to have flare up times, and then it's going to have what's it called?
A downtime.
Yeah. So it's not going to always be there. And so if you have this herpes infection, you need to know when the flare-ups have come because you are infectious when the blisters are there.
Okay.
So when there are no blisters...
So you can easily pass it on to somebody else.
Once the blisters are there, when you kiss somebody or share meal with somebody with the same spoon or whatever, you are going to transmit that infection.
Okay.
Same way, if the blisters are there in the pubic area and you have sex with somebody, that person is going to catch it.
Okay.
Now, there's another thing I want to touch on. When it comes to STIs, people think that, let's say I have hepatitis B, so I don't need to protect myself again because I've already got that thing. What am I protecting? Now, you have to because there are different strains of the various viruses. So let's say you have hepatitis B today. It's possible to get reinfected with hepatitis B again.
Oh, wow.
Yes, and it's possible to get infected with hepatitis C on top of that.
Okay.
So imagine this same liver is being attacked by how many different strains of the virus. Obviously, your time on earth will be shorter than the person who got only one. Okay. So you still need to protect yourself. Even if you're not protecting yourself, protect the person you are engaging in the act with. Okay. It's very, very important so that we.
So how would you protect yourself then?
So So general STI precautions take place, the ABC. It applies in this discussion as well. Abstinence, be faithful, and then use a condom.
Okay.
You have to protect yourself. And when I say protect yourself, you, the individual going into the act, you must make sure that you yourself are protected. So you must insist on the condom, or that's you. If you are the man, you must wear the condom yourself. If you are the woman, insist that your man is wearing the condom, or you yourself are wearing a condom. Yeah. Because the only way to protect yourself is by preventing contact.
Put a barrier between
the two of you.
All right.
But having said that, let me just chip in this. There are also STIs that whether there's barrier or not, it will go. So you must make sure that the person
you sound like indisciplined drivers.
Exactly. So you must make sure that the person you are having sex with is somebody that you know and you trust, and you know the person is exactly. Okay. Because the barrier will not protect you from all STIs. Okay. Even something like pubic lice, it is now considered an STI because it's transmitted from one person's hair to your hair. Now you are itching and scratching all over the place. Right. It's not nice.
All right. Well, thank you very much, Doctor. This has been insightful, rather short, but insightful. Yes. Hope we can have a longer session with you sometime. Thank you very much. We have been talking to Dr. Kelvin Owusu, who is the Medical Director for OptimaCare Diagnostics, and we've been discussing the issue of STIs, specifically the three that we talked about just now. Well, we're going to take a break very soon, and we will be back with the next segment. Stay tuned, don't go anywhere.